If you have heard some really weird stories about German healthcare system like not getting appointments, not finding doctors, then today I will share my experience about the German healthcare system and some tips for you at the end of the video. Hi guys, welcome back to my channel. My name is Priyanka and I share all information about living in Germany, working in Germany, studying in Germany or anywhere in Europe. Subscribe to my channel so you don't miss any other updates in future. Let's begin with why I'm making this video. So recently I got a message from one of my followers on Instagram that she really wants to move to Europe or work here, but she has heard from many friends that getting appointments requires a few months and she is facing some chronic illness, so that's why she needs to go to the doctor more frequently and needs appointment faster. So she asked me what is my view of the health insurance or the healthcare system in Europe, and if she can get appointments or how do I cope with such situations. That's why I made this video answering some of the most commonly asked questions, and I hope I'll be able to answer your questions. So let's start with the first question. Is going to a doctor free or paid? So if you have private insurance or public insurance, it doesn't matter. When you have an insurance, you can go to the doctor absolutely free of cost and they won't charge you. Sometimes if you book an appointment and you miss that appointment, then they may charge you 50 euros, but otherwise you can go to them absolutely free whenever you need any doctor. Also, few checkups like blood test or basic dental cleaning is also included in your health insurance and you can do it free of cost. Of course, there can be some more perks, but it totally depends on your insurance. Like private insurance has more such kind of checkups which are free. Plus, when you have a private insurance, you get an appointment real quick. Do you have to pay for medicines? Jein. Jein means yes and no in German. Why I'm saying that? Because medicines are available at subsidized rate at most of the times. So it totally depends on the color of the slip that the doctor is giving you at that moment. Like if the doctor gives green slip, for example, then you have to bear the whole cost. It's not taken by the health insurance. And if they give you a pink color slip, that means some of the cost is taken by the health insurance. So if some medicine costs 10 or 15 euros, then because of the pink slip, it may cost you just 5 euros. For example, I had once fractured my hand in Croatia and I went to the local hospital there. I waited for about 2 hours to get the doctor to check me, and they took my x-ray. They also put a plaster on my hand, and all that was free for me. So I didn't pay anything. I paid only for buying the medicines which I wanted. But when I returned to Germany, the fracture had to be removed after 21 days. And they had to give me some band to support this whole part of the hand. That thing I had to buy from a specialized store for medical equipments, and its original price is I think 27 to 30 euros, but because of my health insurance it cost me just 18 euros. So that's how it can be. Because it was some specialized thing, I had to pay some part, but it was some part. I didn't have to bear the whole cost of that thing. So that's how it is generally when buying medicines or some special equipment for you. But other treatments like the professional dental cleaning or vitamin checkup or putting a crown on your teeth, implant, these are extremely expensive. Vitamin test may be cheap, like 20 to 100 euros maybe, but dental treatments are extremely expensive. Like putting an implant cost you at least 2 to 3,000 euros, which is like 2 to 3 lakh Indian rupees. And I would say that instead of putting that money here, you can book a ticket to India, fit that implant, do a vacation and come back and still save money from those 2,000 euros which you would spend here. That's about the cost. Coming to the most awaited question, what is the waiting time for doctors? Sometimes short and sometimes infinity. Why? Now, this depends on a lot of factors. Like I live in a small city, hence there are limited number of doctors or limited number of patients, and that's why getting an appointment is much easier. Also, the current doctor or family physician that I have, that I'm registered with, has very few patients because they are new. So that's why getting an appointment with them is very easy. But if you live in a big city, then getting an appointment can be a real big hassle. Like they can ask you to wait for 1 month, 2 months, 3 months, or just like next year. Like I had called a specialist here in my city, And when I asked them that I need an appointment for a checkup, they said that they are not taking any new patients, so come after 6 months. And I was so shocked, like, how can a doctor say, I'm not taking new patients? Like, you are a doctor, you need to treat patients, that's your job. So it was very, very confusing to me. But this happens very, very commonly with a lot of people. So, as I said, it depends on many factors, whether you live in a small city, big city, how famous the doctor is. So, how to get quicker appointment with these specialists. If you go to your house arts, that is your family physician, means general doctor with whom you are registered, then you can tell them your problem and tell them how urgent you need a doctor, and they can get you an appointment quicker than you getting it by calling them directly. Or you can call multiple specialist doctors for the problem that you have and see which one is ready to accept you in the shortest of time. Sometimes people cancel their appointments last moment and they have one slot ready, and that's where you can get in and get a doctor for yourself. Next very crucial question is what to do in emergencies where you cannot wait for such a long time of 1 week or 1 month. Then there are specialized government hospitals in cities, or in every city, like a city hospital you can say. The name of such hospital is Klinikum. So whichever city you're living in, for example Munich, then you can type in Google Munich Klinikum and you can go there. They are open 24/7. They have specialists because they are huge doctors. The waiting times can be really long depending on how many people are there that time, because for me the waiting times have been 1 hour to 4 hours. Yes, that's real. 1 hour to 4 hours. Even though it is emergency, you have to wait that long. Once you go there, then the doctor will check you. You may have to wait even longer for the doctor to come because maybe the doctor is on leave and they have to call him, and he or she will come. So it totally depends on the doctor and how readily available they are that time. But you will get some solution on that day itself, waiting for few hours. That's has been my experience. I've been to Clinicum like at least 10 times in my 6 years of living in Germany. Yes, around 8 to 10 times, I can say. And my last visit was just 2 weeks back, where I had so much cough, I couldn't breathe, like it was some new virus maybe. So I had to go to Clinicum, and within 1 hour I got checked. There was a chest specialist who came, a lung specialist, and they said that you just have to breathe. There's nothing serious. You don't even have COVID. Maybe it just happened at this time, and they said you don't even have to do X-ray because all your tests are normal. They took a lot of blood, and that was it. This is also one thing that they don't let you do X-rays. Like I've gone for my hand to ortho specialist, and they say that if you can move it and there's not much pain, why to take X-ray? Don't take X-ray, it causes cancer. So this is what the doctors keep telling you all the time, like don't take X-rays, it causes cancer, until they see you like really serious and you have to go to ICU. They won't let you take X-rays. Next question, very important one. Are doctors here reliable? Again, yes and no. I cannot say. Like I've heard from so many friends like that their disease was just not treated by the doctor. Like whenever I've been to the doctor, the disease was always recognized and they took all the steps that were necessary to get me into a full healthy condition. And touch wood, I never had something so serious, but there were people who had such serious diseases that they had to be operated and stuff. So some of my friends were operated, and unlike India, where when you are operated and they cut a body part, they have to show you. That's a compulsion in India. That's not a compulsion here. So one of my friend was operated and the part was not even shown. Then there was second case with another friend where they had some disease. They went to so many doctors in so many cities, and after a lot of tests and lot of waste of time of about few months, they gave a paper which said that we cannot diagnose your disease. And after 6 months, the person had to go to India and get diagnosed. And as soon as they went to India, within a week, everything was diagnosed. They got the disease. The person was operated and got fit, but that was serious. So it depends, like totally depends on how experienced the doctor is. I always try to go to some specialists which are known. I read Google reviews, I ask friends how they were treated. Many said that Turkish doctors are really good. they treat you really well. Or I try to find Indian doctors because they understand our diet or our lifestyle better, so they are able to diagnose us better maybe, and they also know how or from what health condition we come from India, and say so they can understand us better. So these are some tips that you can use maybe, but otherwise I cannot comment. Ask people in your city if you know about some doctors, that can you go there, how was the treatment, how much waiting time do they have, and then select your doctors. Now some tips for you to be better safe than sorry, because health is wealth and it's very important that you take good care of yourself and don't fall ill. What we do generally is we do a lot of exercise, we try to eat well, we try to stay away from different indulgences, and try to keep our health good so that we don't have to go to the doctor at all. Or what you can do is, if you have some serious problems with your health like chronic illnesses and you need special medicines, it's always recommended that you get a stock of 6 months or 1 year from India itself. Get a prescription when you're getting such medicines, because if you get checked, at least you have the prescription to show that you are really ill and your doctor has advised you to take these medicines. Then some basic medicines you can always get from India because they are way cheaper. I'll give you an example. Uh, we had cold, so we went to the doctor, and the doctor gave us cetirizine, I think for allergy. And cetirizine is a small tablet which costs like 10 or 20 rupees, which is like 10 to 30 cents for 10 tablets. And the same tablet here in Germany, it cost us 7 euros. 7 euros, which is like 7 eights are 56. So I think 600 rupees. So that's a lot of money. And that's why I would say that if you have some basic medicines like cough medicine, cold medicine, fever medicine, or stomach problem medicines, or pain related paracetamol that is given by doctors. So for whatever problem I went, irrespective of what problem I went, first thing doctor gave is paracetamol. So that's really weird. So get a lot of paracetamol from India, because the doctors will give you that, and if you don't have it, then maybe ibuprofen, it will cost you like 5 euros. So better get it from India. And cough syrups, mixed tablets, for example, or some throat infection tablets. Talk to your family physician, get prescription, and get those basic medicines from India, because here they are very costly, and if you have to get doctor appointment, then it takes a lot of time. Also, vitamins related tablets. So get your health checkup in India, like vitamin checkup, blood test, do all that in India, and get tablets for whatever deficiency you have, because it's way cheaper, and it's better to have that in your home in Germany than waiting to go to the doctor and doctor will give something very expensive. So that is my advice to you. And last but not the least, I think this is very important advice. If you feel that you have something very serious, like very very serious, that you have to be operated on, or you need a lot of you need some really good specialist to check you, then take the next flight and go to India. Get yourself checked there, get yourself working into a good health condition there, because here, I don't know, I my friends, not me, but my friends have had not very good experiences with the doctors with major conditions. And Indian doctors treat way more patients. They see loads and loads of patients right from the time they are in their university. So they know way more diseases, way more bacteria, way more things than the doctors here, because here the air is much more better. The chances of you getting food poisoning is very less compared to when you eat in India. So that's why I would suggest that if you feel that you have something very serious about to happen, just book your next flight to India, get well there, and come back here. That will be way more cheaper, hassle free for you than waiting here for 6 months for the specialist to check you, go to clinicum and wait there again, and nobody to take care of you. For example, here, if you're living alone, then it's always a good idea to go to India, especially for dental treatments. I did all my implants, bridges, everything from India, and it didn't even cost 1 lakh for all of it. All the bridges, all the implants together didn't even cost 1 lakh. So that's the last advice for me, and I feel that was very important. So let me know what issues you faced regarding healthcare in in Germany. Let me know what issues your friends face, maybe, or what incidences you heard about the healthcare system in Germany, and I will try to answer those in comments. Now, everything said in this video is totally my experience and all that I wanted to share. So take it in a positive way. That's all. See you in my next video. Bye.